Have you been told that you can't have a hip replacement because you're too heavy? When we talk about people with weight problems, we use the body mass index, or BMI, to classify them. It's measured by dividing your weight in kilograms by the square of your height in meters. The normal BMI is between 18 and 25. Overweight is 25 to 30 and obese is over 30, with class 3 or morbid obesity being a BMI of more than 40. If your BMI is more than 50, that's called super obesity. Being seriously overweight increases the risk of all kinds of medical problems, including diabetes, high blood pressure, heart attacks and strokes. Many people are overweight are more likely to be depressed and have poor mobility, which makes things, of course, even worse. But what does all this mean if you've got a painful hip and you need to have surgery? Being overweight does increase the risk of developing serious complications after surgery. These include things like wound infections, dislocations, and having to have further surgery. Because of this, some healthcare providers have set weights on who can have surgery. Some say they won't offer it to someone with a BMI of more than 35. As a surgeon, I can understand this. If someone's carrying a lot of fat around their hips, then it can sometimes be a long way down to their hip joint. You have to make a bigger incision, which means that there's more bruising, more bleeding, and a higher risk of wound infections. The operation takes longer, and actually it's quite hard work. So what's the best way to lose weight? The easy answer, of course, is to eat less and move more. We all know that that is the truth. Some people delude themselves and they say that they only have to look at food to put on weight, or they've got an appetite like a bird. I mean, come on. It's not easy, I know that, particularly if you're living with the misery of a painful hip and you can't take much exercise. But you have to face up to it though. It is your responsibility at the end of the day. I've been looking at ways to help people in this position. The way to success in weight loss is to focus on what you are eating. Do not put anything in your mouth without knowing how many calories it contains. Keep a food diary. Record everything that you eat and drink. Stop eating bread, biscuits, crisps and chocolate. Don't buy these things. If they aren't in the house, you can't eat them. Cut out alcohol. A glass of wine contains as many calories as a Kit Kat. Tell your friends and family not to buy you treats or lead you astray. There's an excellent free app that the NHS has developed, and I recommend that you download it. It's called the NHS Weight Loss Plan. It guides you through a 12-week plan, and it's got some excellent reviews. I'll put a link to it below. There isn't a magic wand when it comes to weight loss, but you might have heard of a new drug called Semaglutide. It's just been given regulatory approval. It's an injection that's given once a week for up to 2 years. Some studies have shown that people can lose, on average, 12% of their body weight. It works by suppressing your appetite. Elon Musk, Jeremy Clarkson and Kim Kardashian have used it apparently, and they've lost weight successfully. The National Institute for Health and Care Excellence in the UK has suggested that it can be used for NHS patients who fulfil certain criteria. These include a BMI of more than 35 with an associated weight-related condition such as diabetes or high blood pressure. If you're in this position, then ask your doctor for advice. You can buy it online, but I wouldn't recommend that. Like any drug, there's always a risk of side effects and adverse reactions. Use it only under medical supervision. I hope you found this helpful. I know it's a bit harsh, but it is fair. I know how miserable life can be when you're struggling with a painful hip, and it's easy to slip into bad eating habits. If you take control though, you'll feel much better, and it will make your recovery from surgery so much smoother. If you'd like to know more, then please get in touch. The details are below. Thanks again for watching. See you all again next time.